Welcome back. 6:16 and 51 degrees on this Tuesday morning. Well, did you realize that there is a material that a dentist can put in your mouth, but it's not allowed in a landfill? Yeah, that's right. Our dental expert, Dr. Rick Coker-Jones, is right now to tell us about this. So what material are we talking about?
We're talking about silver amalgam, which is a material that's been used in dentistry for 150 years.
150 years.
It's one of the first ones that was when dentistry really became a profession. It's easy, it's inexpensive, it seems harmless. You know, there are a lot of things about it.
What is it?
It's a combination of mercury, tin, silver. There's a lot of different metals that are put together, and it kind of has a liquid phase that where you can, if you ever had one, there's a little squeaky noise that when you're compressing it into the tooth.
Sounds fun, squeaky noise.
It's a strange deal. And then it hardens, and it becomes, you know, part of the tooth kind of thing.
Okay, like we see there in these pictures that we have.
Right.
So the first thing I'm thinking is mercury.
Right. That's one of the real concerns, and that's the reason you can't put the material in a landfill is because of the mercury content. This is a controversy where you can get two dentists arguing, they'll go to fisticuffs real easily because,
I bet.
Because the people, and the arguments on both sides are good. On the one side, it's been used for 150 years. There have been hundreds of scientific studies done. Nobody can prove that it does any harm to the health. You know, that sort of thing. On the other hand, you've got mercury is a huge concern environmentally right now. That we think that it damages teeth. I think that it causes teeth to break more frequently. But the problem is it's inexpensive, and to do it with the tooth-colored materials it costs more, and it's more labor-intensive, and it's more difficult.
Right.
It's hard to do a good job.
So, I mean, are you having to remove these fillings?
Yes, I have probably half and half. Half people come and say, you know, I just don't want that in my mouth. I'd just rather not have it. And a lot of people say, I just hate the way it looks. You know, when I smile or when I open up, it's just
I'm sure it's very
dark.
visible.
Yeah, it's just dark, and actually with age, it darkens the tooth. So, you know, it just gets darker and darker. So that's
so if you do have this type of filling, you can come in, you can have it removed.
It can be replaced. I would not want anybody to think that they need to do that for their health's sake.
This is not required.
It's not a cure for cancer, or, you know, your hair won't turn back darker.
Why not? Yeah.
But there's just been no evidence to show that it's a health risk. It just seems that there's some significant questions out there right now, and nobody's got any good. That's why it makes a good argument, because there's good arguments on both sides.
But it's good to know, though, if you do have this type of filling and you do have questions about it, you know, in the dental community, go to your dentist and have a consultation.
Absolutely.
And of course, if you have any questions, you can reach Dr. Rick Coker at 581-7